Hi, everybody. Welcome to Unified Purpose. This is the podcast where we share inspiring tales of compassion, resilience, and community spirit. You know me, I'm your host, Daniela, and I'm Penji's Partnership Coordinator. And today we have a very special guest, Joanna Sabotau from Ronald McDonald House. Hi, Joanna. How are you doing?
Hello, Daniela and Penji. It's so great to be with you guys today. Thanks so much for having me on the show.
It's so great to have you as well. I'm really excited for our episode. I'm a huge fan of what you guys do, so we're going to have a great time.
Yes.
But to kind of get the ball rolling, get everything started, and kind of telling our viewers more about you, for anybody listening that's not familiar with what you guys do at Ronald McDonald House, can you share what the mission is, the impact that you're making for families around the world, everything that we got to know?
You got it. So at Ronald McDonald House, essentially our purpose and everything that we do is working with families and providing essential services that remove barriers such as accommodation, access to meals while family has an ill or injured child. And it was really built upon this belief that our co-founder, Dr. Audrey Evans, had literally 50 years ago in 1974 in Philadelphia, Pennsylvania. And she believed, what's that?
Sorry, no, I said that's where Penji's from.
Oh, okay. So cool. I wonder if Penji's been to, so Dr. Evans was the head oncologist at the Children's Hospital in Philadelphia. And she saw every day patients coming in and needing access to accommodations, a warm meal, a community of support while their child was undergoing chemotherapy treatments. And she had this really profound insight that still remains true today, that a sick child is a sick family. And she really was a pioneer in helping families access healthcare through accommodation and other resources so that you can keep that family unit together. And our research shows that when families are together, it actually improves the health outcomes of the patient. And so today, what once was just this idea that she had 50 years ago has now spread into a mission where we're serving millions of families all around the world. We have over 1,000 programs that provide services to families, again, beyond just accommodation, mental support services while they're in our care, quite literally access to care through our Care Mobile programs, and now have reach in over 60 countries all around the world.
That's amazing. I think like what you said about a sick family is like a sick child is a sick family is so true. And I think one of the biggest struggles that you have is also just trying to balance providing for this sick child whilst also providing for the rest of your family who is, not sick, but also has needs, which is really important, I think. And I love that you guys have been able to, can't believe you expanded to over 60 countries. That's a lot of places.
It is. Yeah. I think to your original point, like someone's got to take care of that caregiver, right? And we feel that there is a role, and the data again validates that when you care for that caregiver, again, it can help improve the outcomes of the child. And so, imagine that, you have a child who, heaven forbid, is going through chemotherapy, successfully gets through their chemotherapy treatment, but then mom and dad and sibling have had to sacrifice everything. Like we want to be there with resources that again take care of that caregiver, allow that family unit to stay together, and that it's such an honor to be able to be doing that all around the world today.
No, for sure. I wouldn't say this is a similar experience because this wasn't a child, but when my grandfather was, he got diagnosed with cancer, like I think late in his, maybe like mid 70s, early 80s. And when he got diagnosed, I think a lot of people thought, like, the doctors were like, yeah, he's not gonna, like, he doesn't have much time. Like, this is a very aggressive form of cancer. And he lived far longer than doctors predicted. Obviously, cancer did end up taking him, but I think I have the theory that a lot of, like, the reason that he was able to sort of stay alive for so long was because we never took him, like, I remember my family, they would take him to the hospital and everything, but my grandmother and my mother and my aunt, like, it was always just like this family unit of
Yeah.
taking care of him until, like, the literally last day. And I think, like you said, like what you mentioned is having those people around you really does change that experience. I mean, at least, like, in
Completely.
my opinion.
Totally.
Yeah. It's just like, and it's hard to quantify, I feel, or like prove it, but I feel like when you see it happening, it's like, no, it totally makes sense. At least that's how I feel.
Yeah, absolutely. Yeah. And I think again, we've done research on this that actually does validate that when those families are together, it improves the outcomes. So hence why we're putting so much emphasis into the program and services that we offer and finding ways that we can keep that family unit together, just like Dr. Evans did 50 years ago.
So, for actually, like what you guys do and like the work that you do, what does it actually look like on like a day to day of like keeping families together? What does it mean, or how does that sort of work around?
Manifest. Yeah.
Yeah.
So we have two core programs that most people are familiar with. So our Ronald McDonald House program and then Ronald McDonald Family Room program. So our house programs are quite literally footsteps away from a children's hospital, really helping to, again, remove access to care barriers that families are experiencing when they have an ill or injured child. And then within that house setting, while yes, we're providing them a free room and bed for that family to be able to stay, within that house setting, there are so many other services that we are providing to families to just help with the financial toll and the emotional toll that families are experiencing while they've got that sick kiddo. So many of our services within that house environment will include, oh my goodness, out in Palo Alto in California, and this is true of a lot of house programs, we will bring in or work with the local community so that there is a teacher from the local school system who is maybe who is teaching sibling or the child that might be pulled out of school because they're going through, a 3 or 4 month kind of stint at the hospital. That way, the child or the sibling isn't falling back on their school studies. Right now, one of our bold ambitions is that we ensure that every one of those Ronald McDonald houses or family rooms offer access to at least one meal a day. We know that so many of our families will come to us already before this medical crisis, but with food insecurity challenges, and a nourishing meal is something that, again, many of our house programs will offer to families. And our goal is to make sure that all families, when accessing our house or family room program, have access to the meal. And then those family room programs are quite literally within the hospital setting. Some of them will offer sleeping bedrooms. Many are located within a neonatal intensive care unit, so within the NICU, where parents quite literally don't even want to walk across the street to the house. They want to be with their newborn baby, like on the same floor. And so these family room programs, some again will offer everything from free laundry to somewhere to sleep, access to a meal, but then just also access to other families that are going through a similar circumstance. And then I would say outside of those kind of two core programs by which we're known, our chapters are really innovative in thinking about the needs of their local communities in which they're serving, and how we can be showing up with additional services and local programs that are supporting the family's needs, not only during a child's hospital stay, but also more upstream, kind of pre-diagnosis, and then when they're returning home. And I'll give you one really good example of this, which is in Brazil. This chapter is incredible. And the chapter has been working for years and years to support families who have a child with cancer. And in Brazil, pediatric cancer is one of the leading causes of death among children across the country. And so this chapter saw that beyond providing housing and accommodation or access to a family room through our house and family room programs, they thought, what role could we play in helping to potentially reduce the number of kiddos that actually are diagnosed with cancer. And so they have developed a early diagnosis of pediatric cancer program, which includes about 34,000 healthcare professionals, students, with basic education around early detection and warning signs of cancer. And through this early diagnosis program, they have been able to intervene and impact more than 11 million children through this program. So literally they saw, like, we would hope that families don't even need to have access to a Ronald McDonald House. What role can we play? Early detection is one of the reasons why cancer amongst peds is so prominent across across Brazil. So they, again, just developed this program, and it's really remarkable. So while what is true to who we are is, providing services that, support families, there is a little bit of local taste and flavors, if you will, in how that comes to life, depending on the needs of the local communities. And Brazil's just one example of many different ways that we're supporting families.
Because actually my next question was regarding sort of the international side of what you guys do. And so I'm so glad you brought Brazil up. You said you were operating in over 60 countries. I assume that cultural, budgetary, like land, geographical location related things change how that operation goes. How do you actually work around the alignment of that?
Yeah, I think in a couple of ways, one, the kind of more broadly, what we know is that the needs of families are evolving. And so kind of really to be part of the RMHC system, we call them our chapters, or independent nonprofit organizations that run their own Ronald McDonald House programs. And we want to make sure that kind of core, in order to be part of the Ronald McDonald House mission and brand, that all of our chapters, have either a Ronald McDonald House or one of those family rooms like we talked about. But then we really encourage the chapters, based on the needs of their local community, to think about what other programs and services they might be able to offer families that, again, either remove barriers via access to care, or allow that family unit to stay together. And because the needs of the families look so different, healthcare systems look completely different from country to country, let alone from, state to state or region to region, wherever you're at. That's, I think, where there's such beauty in our mission, and that we stay true to who we are, which is supporting families, putting families at the heart of care, but allow that chapter a little bit of flexibility in developing other programs and services based on the needs.
And that's amazing, which actually it leads me to the other question that I have, which is, when you think about, I feel like the demand for stuff like this is growing, especially when you're looking internationally into like rural communities, areas where there's a lot of less housing in general and stuff like that. How do you guys actually work to adapt or expand to reach this demand?
Yeah, so we have a whole growth strategy. One of our kind of long-term goals is We want to double the number of families that we serve by 2030. Right now, our kind of the analysis and research that we have done in partnership with Accenture has says that we're meeting about 35% of global demand. So what does that mean? It basically means of all families that would need access to Ronald McDonald House programs or services, we are meeting about 35% of that demand for a couple of reasons. One, we just might not have a program in particular different areas of the world, or maybe our programs and services are at capacity. House could be on a wait list, and so we quite literally do not have enough bedrooms to be able to host those families. And so with this ambition of doubling the number of families we serve, we're really thinking about not only how we double those numbers of number of families, but where we kind of focus that expansion so that we'll be having the greatest impact. And a couple of different factors kind of go into how we think about growth and expansion is one, there's lots of changes that are going on right now with regards to the healthcare the healthcare landscape in general. And so we're seeing that healthcare systems are consolidating. And because of that, families are having to travel longer distances and stay for longer durations of time. And the impact of that is then it's putting more demand for our programs and services. So we're also kind of thinking about that and knowing the changes in the healthcare landscape, where we need to be expanding our reach so that we can just serve more families and serve them better.
That's amazing. I mean, I feel like also it must be kind of complicated because I think about healthcare in different countries and how much it sort of changes. Like American healthcare is a beast in and of its own, and then you sort of start to branch out to how people do that. Like I'm assuming health insurance also plays a big thing, whether these families come in with health insurance.
Oh, yeah.
Yeah. So, for example, when I used to live in Taiwan, everybody got health insurance just because they like any job that you would get, like a corporate job, would give you health insurance. And students, like pretty much everybody had health insurance very easily. And here in El Salvador, which is where I live now, health insurance is not like that. If your job is giving you health insurance, that means that this is a really good job because they're giving you that benefit. And you can either apply to your own private health insurance or you can apply to like the public one, but it's really complicated. And then actually going to the healthcare stuff is complex. And I think it really affects, like, I think if you're a healthy person, you're probably not going to you're going to be fine because you're not going to need to go to the doctor that much or need to do like really expensive testing or treatment. But I move it towards like people where there's an ill family member when you need like constant surgeries, or you talked about chemo or things like this. And I assume that like stuff like this also takes a really big toll on the family because they need to have so much money just set up for all of these treatments.
Yeah, you're absolutely right. The complexity of healthcare systems, insurance or lack thereof of insurance systems. There are, in the 60 countries where we're at, no two that are the same. The needs of those families therefore look very, very different. So how we kind of solve for those challenges or strategic tensions, again, looks a little bit different from country to country.
Yeah, that's amazing. And you mentioned you had like a whole structure and everything. But I'm curious about like if we look at it from like marketing and communications, how do you keep the brand, with like a fresh mission when it's also very globally recognized? And you kind of keep that mission going and that it's engaging, that it's emotionally resonant.
Yeah. So I hope all of our listeners or viewers on the show would have seen that we just unveiled a new name and an updated visual identity. If you're joining us via video, you can see our beautiful new logo. But I think one of the amazing things about the RMHC or the Ronald McDonald House mission is that, again, we have 250 independent, we call them our chapters, across those 60 countries and regions around the world who are custodians of the brand and really bringing that brand to life through local grassroots efforts on a local level. And because of the fact that this mission started over 50 years ago today, and the impact that we have had in serving families over those past 50 years, it brings a level of trust and credibility to the mission. And so in honor of our 50th anniversary, one of the ways that we kind of this year are focusing on staying globally recognized is through this beautiful new brand identity, which I just think is such a cool expression of quite literally our commitment to putting families at the heart of care and at the heart of their child's healthcare journey, with the new heart in the middle of the house. The house is the core program that we are most famously known for. And chapters starting now in October will be rolling out and transitioning to the new name and logo. So you all will see that new name and logo coming to life between now and the end of 2027. So stay tuned, and definitely, I think, follow us on social media. We'll be doing some really fun things with some celebrity ambassadors to just reintroduce the world to kind of the next 50 years of Ronald McDonald House.
That's amazing. We will be adding the links to this so that people can also easily access them and see them. So, we'll definitely stay in touch. And I also wanted to ask you, because we're going a little bit more into the technical side. What are some challenges or I think misconceptions when it comes to marketing for an organization like yours that you think you have to sort of overcome?
Yeah. I'll maybe just speak to Ronald McDonald House. Our hypothesis was that people know who we are, but they don't fully understand the breadth and depth of what we do. And I'm going to maybe test to see if that hypothesis is true. Did you have any idea about that program in Brazil, or the other ways that we're supporting families?
No.
All right, so we just did a little survey of one, but we did go into some pretty extensive multi-market consumer research to validate whether or not that was true. And in fact, it is true that most, again, have heard of the name, kind of know that we have something to do with maybe children and families, but don't really understand the breadth of what we do. And because of that lack of understanding and clarity, it impacts our ability to reach people, to get people to donate, because no money, no mission, to get volunteers to come to the house programs. And so as part of what we are calling our brand modernization journey, where we've updated the identity, our name and logo, one of the things that we're also working on is a broader kind of communications approach that you'll see now with our new communications platform that we're just unveiling, so that we can better articulate and drive awareness, through television and radio around who we are, what we do, and the impact that we have. I think one of the other things that we're focused on right now that's part of our kind of bigger brand strategy is we need to be building relationships with the next generation of donors. Right now, many RMHC donors and supporters are kind of that boomer segment or alumni families. And for many millennials, Gen X, Gen Y, and Gen Z, they're not as familiar with us, or they might not yet be parents. And so they might have just like a different experience with like understanding the importance of keeping that family unit together, than another generation that has family, like that has a child or a grandchild, et cetera. So we're having to like think about, through our communications approach, how can we bring different cultures, different generations into this mission.
Yeah.
Totally, that might have a different experience, so that they too want to support us as well through volunteerism, their time, talent, and treasure.
No, I totally get that. It's interesting to me because when I was usually, when we're doing like research for the nonprofits that we talk to for the podcast, and we're trying to find people that we like their mission. I had the experience where like I didn't know about you guys, but my co-host was very familiar, and she's like, "Oh, it's like like the McDonald's thing," and I'm like, "What are you talking about?" And I think because that's my theory was that it was maybe very popular in America, and it's not that popular like here in El Salvador, for example. I don't know if you guys have here, maybe that's why I hadn't heard of it. But I started doing research and I was like, wow, they're big, like like they're not just. I couldn't believe that was not something that I had ever found out about. So I can totally see, like how that would affect, because if I was in a situation where I needed this help and I lived in a place where I could access this help, but I didn't know about it, that would have been just like a huge loss of opportunity.
Totally. Yeah, absolutely. And I think, one of the other thing that you mentioned, so your coworkers said, oh, that McDonald's thing.
Yeah.
What's also really interesting is that there is a perception, because McDonald's is in our name with Ronald McDonald, that we are solely funded by McDonald's, which isn't the case. And so remember, we talked earlier that Dr. Evans, one of our co-founders, her idea to start the very first house. This is the craziest story, Daniela. The local McDonald's owner-operators in Philadelphia, Pennsylvania, did a fundraiser, and they took the proceeds from the Shamrock Shake. They're very they're super popular here in the US. It's like vanilla and mint. I digress. They're delicious. But they took the sales from Shamrock Shake in these restaurants in Philadelphia to purchase that very first Ronald McDonald House in Philadelphia. And as a way to show our thanks and appreciation, we named it the Ronald McDonald House in honor of that beautiful fundraising gesture that McDonald's has done for us. And so McDonald's, while they don't fully fund the mission, their customers, their franchisees, their crew are huge supporters of the mission, but we rely on funding from people like you and I, from other corporations, to be able to meet the needs of all the families that we want to be able to serve. So it's also like this other kind of interesting thing that people don't know. And then when we share with them, they're like, oh, that's pretty interesting. Like McDonald's has been doing corporate social responsibility before it was a thing, just as an organic way to, to support families and keep them together.
That's amazing. And I think that's a great way to end the podcast, by telling people to donate, yes, to always keep that huge, important thing in nonprofit work. I think no matter how big it might seem, whatever you can give is always going to be helpful to these missions. So I'm going to leave all of those links in the description for people to easily access. But before we end the podcast, I do want to give you the space to also plug anything right now. Ooh. Whatever you want to shamelessly tell people to do. Space, floor is yours.
Oh my gosh. Okay. Well, first and foremost, visit ronaldmcdonaldhouse.org, which is our website. Excuse me. And there's lots of ways to get involved, opportunities that you can learn more about the mission, again, we're in 60 countries around the world. So there's local, likely a local program in the community where you live, and just learn more about who we are and all of the incredible ways that you can support the mission. And just, I want to say thank you to you for having me on the show to talk about like my favorite topic, which is families, and how together as a world and a community, we can just keep them all together.
No, for sure. And I'm so glad to have you. I always love platforming missions that I believe in. Like I never have people on podcasts that I don't like don't believe in, or I don't want to support the mission. So I'm super happy. Thank you so much for being here, Joanna, and everybody else who is watching. Subscribe to our channel, follow us, like our videos, everything. And thank you so much for being on the podcast today.
Oh, thanks.
Thank you. Okay, everybody. I'll see you on the next one.
Take care.